factor down to the pituitary. And the pituitary gland is in our brain, and basically the pituitary gland is the master gland, and the pituitary gland secretes quite a few hormones. And the pituitary gland, in relationship to the thyroid, secretes the TSH levels. And that's the thyroid-stimulating hormone. And what happens there is, and then the thyroid gland produces T4. 93% comes out of the thyroid in the form of T4. And then you have 7% that comes out in the form of T3. And then I said before, 99% of that is bound to a protein. And then you have the T4, the free T4, and the free T3. But that has to be converted. The T4 has to be converted. It's usually done in the liver. It's also done in the brain, and also at the cellular level. And in order for that conversion to occur, you need selenium and zinc. And that conversion is blocked by cortisol. So if you're under stress, whether it be tissue damage, inflammation, pain, mental or emotional stressors, or blood sugar problems, that can all affect this conversion factor. And then you can see 60% of the T3 goes to your cells, 20% goes into reverse T3. That's why you have to have a healthy gut so you can convert this reverse T3 back into the active form of T3 so it can get to the tissues and cells. And then we have the enzyme in the gut called intestinal sulfatase that actually performs that step to do that. So you can see that, people say, well, that's only 20%, but realize over the year, it's time, you may only release 2 tablespoons of thyroid hormone. So, there's not a lot of thyroid hormone that is produced in the body, so every little bit that you need actually is needed to actually work. So that's what we look at, and it's very important that we understand, and I apologize for clicking through those, it's very important that we understand that we check all these functions here. So we have to make sure that when the thyroid it gets too low in our blood, the thyroid hormone gets too low, what it does is sends a feedback loop up here, and it turns on these chemical messengers to produce more in the body. When it gets too high, then it tells the pituitary to quit producing TSH. So you can see that there's various steps that occur in the chemistry of the thyroid, and so we have to check each one of these steps. If we don't check each one of these steps, then what happens is that we're not going to be able to find out exactly where the problem or the thyroid gland is not functioning at its optimal level. So the whole goal of this is to actually treat your thyroid gland properly, and if you'd like more information in regards to this, I'd recommend you purchase my book, Your Thyroid Chemistry Doesn't Lie, and I'll be showing you a copy of that in a second, and we'll have somebody bring it up for me, but you can purchase this on the website, and basically it's Your Thyroid Chemistry Doesn't Lie. We talk about the things in greater detail that I discussed here on this livecast webinar, and we will be doing additional webinars, so please check back on the website to make sure that you're signed up for the additional webinars. Sometimes we do them live where you can see me, other times we just do a webinar where you just actually hear my voice. On those particular ones we have live interaction where you can actually ask me questions. You can also contact me through the website Balance Your Chemistry, or you can contact me drkungar@gmail.com, and that's my actual personal email address, so you can actually do that, and I'll be more than happy. Now, I can't answer all the questions that come through because a lot of times I may get hundreds in a day, and there's only so many hours in a day. So that gives you an overall view on what to do and how to balance your thyroid gland naturally. So we have to look at the different aspects. We have to look at the nutrient levels. We have to look at the thyroid stimulating hormone. We have to look at the free T3. We have to look at the free T4. We have to look at the thyroid antibodies. And I just want to touch a couple minutes on the autoimmune disorders of the thyroid gland, such as Hashimoto's and Graves' disease. A lot of times autoimmune disorders are usually from when you have something going on in the gut. We have to realize that 60% of our immune system comes from our gut. And when we have an unhealthy gut, that's going to cause our immune system to become disorganized and confused. And what happens is that it starts to attack our healthy tissues. And so in autoimmune disorders such as Hashimoto's or Graves' disease, our immune system is actually attacking our thyroid tissue. And that actually causes us to have all these symptoms. So, the first thing, as I tell patients, if you do have an autoimmune disorder, I highly recommend that you do a gastrointestinal panel and see what your gut looks like. Because if you don't clean up the gut, you're not going to be able to calm that immune system down. So those of you who are suffering from that, there is help from a natural standpoint of view. And you need somebody who practices functional medicine to be able to bring all these pieces of the puzzle together to find out exactly what's going on with your individual chemistry, because everybody's chemistry is different. On the last couple of minutes here, we're just going to kind of reiterate what's the most important thing, and the most important thing is to communicate with your doctor. If your doctor's not willing to run your TSH or free T3 and free T4 blood test, you can actually order those online. If you want an adrenal stress index test, you can actually order that online at balanceyourchemistry.com. And it's important that you do an array of these tests because that way you're not going to miss anything. You can try to treat somebody with a thyroid problem, and if they have high cortisol levels due to stress, maybe due to a blood sugar problem, if you don't address the underlying blood sugar problem, you're never going to get the cortisol levels to come back down to allow that conversion of free T4 into free T3 to occur. So that's very important to look at the whole parameter of what's going on with the endocrine system that relates to the thyroid gland. And the adrenal glands are very important. I can't talk enough about how important the adrenal glands are because they can affect a host of things in the body. When you have high cortisol, that also thins out the lining of the gut. In the gut you have a mucosal barrier called secretory IgA. It's a mucosal barrier, and I tell patients it's kind of like a piece of saran wrap that lines your gut. And when that saran wrap gets thin or there's holes in it or gets pulled down, what happens is that allows the bad bacteria in your gut to get into that intestinal lining and cause inflammation. And then your body has to produce its own corticosteroids to fight that inflammation in the body. And then the high cortisol levels, what happens is it starts to thin that lining out, and then you get, if it progresses for long periods of time, you can actually get to what most people call leaky gut syndrome. And so all these things play a big role in how your health is. And a lot of times when we run GI panels, we'll find that people are sensitive to certain foods. And in the gastrointestinal panel, we check for milk, soy, we check for eggs, and we also check for Gliadin antibodies or glutens. There's a lot of people who have gluten intolerances, and anytime you eat these foods, whether it be milk, soy, eggs, or gluten, anytime you eat any food that you have an intolerance or sensitivity to, a half an hour later in your stomach, it causes an inflammatory process. And if you don't address the underlying inflammatory process, what happens is your adrenal glands are going to be pumping out cortisol, and pretty soon they become fatigued, and then they're going to affect a whole host of other symptoms and lead you down the path to other diseases. And so you want to really get a baseline on your chemistry. That's the most important thing because we need to know where we stand. I don't care if you're 20 years old, 30, 40, 50, 60, 70, or 80, you can still get a baseline on your chemistry and find out where you stand right now. A lot of times the beauty of functional medicine is that early detections of these shifts or these imbalances in our biochemistry can help us prevent you from going down the road and end up in a disease state. So, that's what wellness and prevention medicine is all about. It's not about where someone's going to give you a glucose meter so you can keep track of your glucose and you're not doing anything to bring your glucose down. That's not prevention by any means. So, healthy dietary lifestyle changes. Making sure that you exercise, making sure that you take your supplements, all an important factor if you want to have optimal health. And from functional medicine, I do want to talk one other thing about the lab reference ranges. In functional medicine, what we do is our lab reference ranges are much narrower. And the reason being is because we want you to function in a more optimal level. Because if you really think about where they got these lab reference ranges from, what happens is that they have a big bell curve, and what happens, they take all the people, say in Northeast Ohio, and they take all their TSHs, and then they put that in a bell-shaped curve, and then they say, okay, this is the normal range. They throw the high and lows out, they get a bell shape, and they say this is the range. But how many people that had a healthy thyroid went and had their blood checked that year and was included in that bell-shaped curve? So we like to use a narrower range because your body will function at a more optimal level, and when the body functions at a more optimal level, you're going to see incredible results. So those of you who are suffering from inability to lose weight, low energy, you're fatigued, you're tired all the time, you fall asleep at the same time, an hour and a half after lunch every day, you go to bed, you're exhausted, you wake up in the morning, you're still exhausted because maybe you didn't sleep well, you didn't get in your deep REM sleep, or maybe you had an adrenal problem where your cortisol levels were being elevated and it woke you up and you can't get back to sleep. If you're suffering from these symptoms, there is help out there, and this is natural help where we actually fix the problem and we just don't give you a drug to mask the underlying problem that's going on. So my name is Dr. Keith Ungar, and I appreciate you attending this webinar live, and we'll look for you next time. I'm Dr. Ungar, signing off.